You heard him as he returned to the White House last night. Joining us now for more of the conversation, infectious disease expert Dr. Amira Roess. Dr. Roess, I want to just go right to what the president just said, telling people don't be afraid of the disease. What was your take on that when you heard?
Well, frankly, I thought he is coming at this from a position of privilege. He's the president of the United States. He has access to healthcare 24/7. He always has a medical team with him. He lives in the White House where there is a clinic, and it is somewhat irresponsible to tell the general public who doesn't have access to this level of care not to be afraid of the virus, because the reality is most individuals who are in his age bracket and who have similar underlying conditions of him as he does are in a very precarious situation if they do become infected. And we know that individuals in the 70 and plus age group have a greater chance of really severe outcomes and even death than the average individual or individuals who are younger. So I think this was a really troubling message.
It wasn't just the president saying don't let this dominate your life and that we have the best health care here in America. It was something else that he said that got a lot of attention this morning. Let's listen in.
I know there's a risk, there's a danger, but that's okay. And now I'm better, and maybe I'm immune, I don't know. But don't let it dominate your lives. Get out there, be careful.
I wanted to bring to your attention, Dr. Roess, the part where he said, maybe I'm immune. What's your take there?
So right now he is infectious. He is not immune. And I think this is also a really important distinction that many people are missing. At this point, he can be transmitting the virus to anyone he comes into close contact with. And so, saying that you're immune is just factually incorrect at this point.
The president and what we know about his status, and granted, the White House physicians are not giving all of his vitals or information, but from what we know so far, where do you place him on that spectrum of levels of care and recovery at this point?
He's not receiving the sort of regular care that most of us would receive. He is receiving state-of-the-art, world-class care. And so that places him in a really good position to have a good recovery. The rest of us are not, we don't have access to healthcare 24/7. We don't have a physician on call 24/7 living in the same quarters as we do. And so that completely changes the game. He has access to compassionate use medications like the Regeneron, the antibody treatment that you all had mentioned. He has access to lots of treatments that the rest of us don't, and that changes his likelihood of a recovery, or at least it really reduces his chances of having very severe outcomes and even death. The rest of us, we're not privy to that kind of care.
I liken this in a way, and this is a broad analogy, but if you're watching a sporting event and maybe you play the sport, you're going to focus on things a little different as to what's happening on the field. Are you watching these doctors perhaps differently, what they're saying, how they're acting, how they're describing things, perhaps a little differently than we are who did not go to medical school? And if so, what is your take on the information that we've been privy to so far?
Well, I think that there are a few things that have come out that are a bit concerning. It's not clear when he became exposed, when he became infectious. It's not clear, how severe his symptoms were on Friday to prompt his healthcare team to, perhaps insist on hospitalization. So all of that is somewhat unclear, but it is, raising a lot of concern. And, he was sick enough that the clinic and the healthcare he was getting at the White House wasn't enough. And so he had to get hospitalized. Well, we also know that he's on right now a steroid treatment that can, leave patients feeling stronger than maybe they would have been without that treatment. And so, that might explain his optimism and his his coming across as feeling fine and his saying that he feels good. So, those are the things that I think a lot of us are questioning and looking at very closely. For a lot of individuals who do get steroid treatment, they do tend to feel well, and they have boosts of energy. And then oftentimes you have a drastic decrease in health status following that, especially in individuals in his age group and with his underlying conditions. And so that is something that we're watching.
Going to have to leave it there for now. Dr. Roess, thanks for joining us this morning. President Trump again waking up at the White House for the first time since Friday morning. Angie?
And a lot of people lashing out, making their voice heard on different platforms, especially Twitter, over the president's comments. Taking a look right now, singer and actress Barbra Streisand chiming in, responded by calling it preposterous, saying that children have lost their parents, mothers and fathers are gone. How dare he say such a stupid thing. We also had singer Rob Thomas chiming in saying, assuming that you actually had the virus, this won't get you more votes, only ensure that you kill more people with your continual void where leadership is supposed to be. And then we have Chris Evans here tweeting, you've been under around-the-clock care by the best doctors using the best drugs. Do you really think everyone has access to that?